I came into my role just about 6 months prior to COVID. Um, our company, we we've got people that specialize in different things, and we didn't really have anybody that specialized in infection prevention. So um, I willingly took the responsibility of learning more about infection prevention, which was a good thing because there are some local connections that I was able to make prior to COVID with some experts, and we were able to just establish a relationship prior to COVID. And then when COVID came around, then it got to be really hot and heavy, and it was um, realizing that we were going to have major changes in our lives and how we provided our care. Now, we didn't realize how significant they would be. We just knew that it was going to happen. It was going to come. Um, so then as we're sort of winding down from COVID, don't get me wrong, we still have COVID out in our communities, but we needed to move on to the next chapter. And we saw that, with increased focus with infection prevention, um, potentially bad outcomes and stuff, that we really needed to dedicate more time to it. So that is what I do with all of my time now, is dedicated to teaching, visiting with, educating our infection preventionists in our company. We have roughly 30 different facilities from AL to SNFs, probably 25, 24, 25 SNFs. So I work with all of the infection preventionists in our SNFs to try and help educate them, like best practices, or if they're just brand new, sort of the importance, some of the processes that we do, and the reasoning why behind it. I really try to do the whys because honestly, COVID is inevitable. It's going to get into your building, or influenza or norovirus. I try and stress the importance of identifying early so that we can isolate appropriately and hopefully prevent a widespread of whatever illness is going on. Leadership can help support the IP and support IP practices. As they are doing rounds, visiting with team members, visiting with residents, having their morning huddles or daily huddles, when they're walking the halls, they can point out the good things that they're seeing. Perhaps, you identify team members with good hand hygiene practices, or if you're doing an audit and for, we'll say, a dressing change, and that nurse is doing everything correctly, giving that positive reinforcement. While at other times, if you see a misstep, addressing it with that team member as well. Now, Dan, I noticed that you had an opportunity to perform hand hygiene after you took the resident down to the dining room. We just need to remember to do hand hygiene after we're providing cares to residents, in between every interaction with our residents, making sure that we're doing hand hygiene, just supporting it that way, rather than relying on Dan, the IP, to identify all of those and address those all by himself. Leadership really needs to, if they see something going well, congratulate, thank the team for doing it well. If they see an area for an improvement, sort of reinforcing that, remember, we need to do X, Y, and Z so that we can keep our residents and our team members healthy. I think infection prevention is very important in the long-term care setting because this is the residents' homes, and we want to promote we want to add life to their years rather than years to their life. And we can do that, adding the life to their years, by keeping them healthy and keeping the community healthy, so that they can enjoy family visits or group activities or whatever it may be, where if they're sick or if there's an illness going around the facility, they're more isolated to their rooms, which decreases their quality of life. the successes that I see in facilities that are rewarding to me is when I go into a facility and say they're in outbreak precautions because of a COVID case or influenza. When I see team members that are wearing their mask correctly, when at the beginning of the pandemic, it wasn't necessarily the case. That is rewarding to me. And I feel that's because the leadership team has explained the whys. The more that we wear our PPE correctly, the sooner we will get out of this outbreak and we can resume our daily activities like we're used to. I hope to champion infection prevention in the upcoming months. I do have a advisory council made up of 3 of my IPs. I want to ask them, what do they need for me to help them become more successful? What do they need from our home office level people for them to be successful? What do they need from their leadership team at the facility level to become more successful? And really, my goal is to make infection prevention important to everybody and them understanding that even though I am EVS in position, I play a key role in preventing infection spread in the building. It's more than just making sure that the carpets are being vacuumed and things like that. By using the correct products and using the correct contact time, I am helping the facility stay healthy so our residents can be out and engaged in activities that they want to participate in. The advice that I would have is you can't change things overnight. We need to tackle things, in my mind, in sort of a strategic order and get some wins under your belt and then promote those wins. And you're going to have some stumbles along the way, but you pick yourself back up and you go right back at it to be more successful. And I look at it as infection prevention hasn't been at the forefront for long-term care for years and years and years, but it needs to be now. And it's going to take time to educate and to build a strong program. It is not going to happen overnight because there's a lot of hurdles that we have to overcome and stigmas that we have to break before we can get to where we need to go. I guess advice that I would have is network. Find some key people that you respect, they respect you, to bounce ideas off of. Even if they're not, in IP, maybe it's another nurse, maybe it's somebody else in a leadership position. Having somebody like a sounding board to keep you in check when you're frustrated, and respect what they have to say to you, because if you're going off on the wrong tangent, they can help bring you back and refocus you. You don't have to do it alone. You shouldn't have to do it alone. You need a network. If that's somebody, that's in another facility across town, or if it's, another expert resource, try and reach out and connect with them. I have also been looking at your Project First Line on AHCA, reading some of those things. It's exactly the same stuff that I've gone through. And then there are some people that weigh in that have very good information that they're willing to share. So I've really been impressed with that blog post that you guys have on AHCA. One of the frustrations I have with infection prevention and long-term care is there are limited learning opportunities. There are several learning opportunities for acute care based education, but I feel like long-term care and acute care infection prevention are in 2 different worlds. Infection prevention in long-term care is you're in a communal setting. So infections can take off in a heartbeat, and you're tracking all of those. It has a major impact. Um, I have been lucky enough that I have networked with a panel of experts that I can reach out to frequently, daily if needed. But everybody doesn't have that opportunity. So I think networking is key to being able to reach out and feel comfortable to ask questions, even if it's a stupid question. There isn't such a thing as stupid question. You just need to expand your knowledge base. And my hope would be that there will be more educational opportunities available for long-term care specific infection preventionists, where we can establish larger networks so that we can reach out to them, um, because acute care and long-term care is so much different as far as what we need to do, what we need to look for, in our settings.